What is psychoanalytic? We continue. We had covered till question 7 in the last lecture. We start with question 8 of FAQ psychoanalysis. Question 8. What is psychoanalytic psychotherapy like in practice? Psychotherapy usually is done in two ways. One is called on the couch therapy, where the patient lies down on the couch and the therapist is beside the patient, behind the patient, seated in a chair, and the therapy proceeds. Second approach is face-to-face therapy, where both the therapist and the patient are seated in a chair facing each other. Psychoanalytic psychotherapy classically is a couch-based therapy. So the patient lies down on the couch and the therapist is seated in a chair beside him and behind him, out of the line of sight of the patient. So the patient cannot see the therapist. And then the patient lies down on the couch and starts saying whatever comes to his mind, which is called free association. And the therapist tries to understand the unconscious of the person from free association using his knowledge of psychoanalysis and offers interpretation or interventions for healing the person. That is how the classical therapy proceeds, psychoanalytic psychotherapy proceeds. In case of CBT, REBT, DBT, ISTDP, many forms of holistic therapy, therapy happens face to face. Both are seated in a chair facing each other. In hypnotherapy, it is slightly different. Some people do hypnotherapy face to face. Only difference being the chair is more relaxing. It's a semi-sleeping chair. And some people use the classical psychoanalytic way of on-the-couch hypnotherapy. Both ways hypnotherapy happens. What are the pros and cons of on-the-couch and face-to-face therapy? On-the-couch therapy is good if the person feels held back because of the shame involved in discussing the most difficult and embarrassing parts of himself, which he finds it difficult to do face to face. In that situation, couch is better. If the person feels the presence of the therapist threatening, in some cases, couch helps. If the person wants to regress back and go into deepest parts of himself and explore the unconscious mind through that regression, a constructive regression, not a pathological regression, then the couch is better. If the couch appears too threatening, then the chair is better. If you're working more with the rational part of the mind, the chair, of course, is better. If you're trying to explore more the states of reverie and the unconscious, the couch is better. For a group of patients, the couch might be too much. And for them, there is no option but to go for the chair, face to face. Kernberg talks about 4 groups of patients. First group, the most healthy, They can withstand any form of therapy and benefit from any form of therapy. They can take on head-on collision, they can take on confrontation, they can take on challenge. Second group, which cannot take on challenge but can take ordinary psychoanalytic interpretations. Third group, which requires holding, and only after holding, interpretations can be given. And the fourth group, the most fragile, for them, just the frame of psychoanalytic psychotherapy itself is disintegrating. And so for them, psychoanalysis is not the right mode of exploring the inner world. In such cases also, face-to-face therapy on the chair can be deployed. Question 9. Why is the therapy room setting so kept, and why is the couch used in psychoanalytic psychotherapy? The frame, as we call it, the setting of psychoanalytic psychotherapy is what we call the frame. And the couch also is a part of the whole structure. So if you look at psychoanalytic frame, the couch, the seating of the therapist, same place, same time, same duration of session, patient revealing everything about himself, but the therapist not revealing anything about himself and continuing to be the anonymous blank screen. All this is designed in order to facilitate deeper psychoanalytic work. And this deeper psychoanalytic work can happen in states of regression, constructive regression, and when reality orientation and the ego orientation to reality and the rational part of ego is brought down to an optimum. Because in the ordinary state of ego consciousness, it is difficult to do deep psychoanalytic work quickly. So in order to facilitate going deep into the unconscious mind, going back into one's life, trying to explore what is deep inside in the subtle way, and allowing feelings to come up, allowing the unconscious to leak out. All of that requires undoing of normal repression, reduction of ego orientation into reality, and getting into a state of what Winnicott calls as unorganizing. Ego does not disintegrate, but the ego takes a back seat. Ego is fully there, not disintegrated. It's fully integrated and cohesive, but it is withdrawn inside, allowing free space for fantasy. It is unorganizing, very different from disorganizing. So that state, in order to be achieved for quick results, deeper exploration, the therapist, the whole frame of psychoanalytic therapy is created. This frame has many elements. The room, the duration of the session, same place, same time, same number of days per week. The therapist becoming the anonymous blank screen, patient doing free association, and the therapist continuing a stance which is amoral, non-judgmental, providing safety, creating a safe space in the therapy room. To facilitate this, the therapy room is kept as austere as possible, as comfortable as possible. The couch is kept in a way that you are neither seated nor asleep, you are in between, in a reverie-like state. The lighting is also suitably adjusted. And the therapy room should have as less number of objects as possible. As austere, better it is. Question 10. How long is each session in psychoanalytic psychotherapy? and how many days a week one has to go for therapy. In psychoanalytic psychotherapy, each session is of 45 or 50 minutes, either 45 minutes or 50 minutes. Some people practice a 45-minute session, some people practice a 50-minute session. In Puritan psychoanalytic psychotherapy, it has to be 5 days a week. Because of time and money constraints, usually many people come only 3 days a week. Less than 3 days a week, Puritans say it is not psychoanalysis at all. Exceptionally, if there is no way out, 1 day a week or 2 day a week is also done, but in rare instances. In Jungian psychotherapy, which is one school of psychoanalytic psychotherapy, Jung used to work 1 day a week or 2 days a week. He dispensed with Freud's 5 days a week. He would usually go for 1 day or 2 days per week. Rare cases 3 days a week, not more than that. And Jung did not use the couch. He went for face-to-face. That's an exception. Question 11. Is there a contract between the patient and the therapist? Yes. Before the therapy begins, a contract is signed. Contract talks about duration of session, number of sessions per week, confidentiality, charges, and so on. The do's and don'ts of therapy. One of the do's and don'ts is that outside of the therapy room, the therapist and the client are not supposed to have any contact whatsoever. And this is an ideal which is difficult to practice in society, especially in smaller cities, where everyone knows everyone and there is no way you can avoid each other. Or in exceptional circumstances where the patient is also a student in training, or the therapist offers a conference and the patient attends, or both therapist and the patient attend a conference of somebody else. But to the extent possible, the contact should be avoided. It is called dual relationship, meaning the patient and the client should have only one relationship, that of the therapist and the client. There should not be any other relationship. And if there is, that is referred to as situation of dual relationship. And ideally, it should be avoided. If it cannot be avoided, the intensity of dual relationship should be minimized. Question 12. Has the efficacy of psychoanalytic psychotherapy been researched and compared to other psychotherapies? Yes, it has been done. And it has always proved to be one of the good options for long-term therapy, especially for deep-seated troubles which cannot be handled by short-term cognitive work or work with only the conscious mind. Question 13, with respect to relapse, how does psychoanalytic psychotherapy compare with other forms of therapy? Psychoanalytic psychotherapy performs very well compared to other therapies if you consider the parameter of relapse. Psychoanalytic psychotherapy takes long, but relapse is low. I believe relapse for ISTDP would be even lower than psychoanalytic psychotherapy. But most cognitive forms of therapy have higher rates of relapse than psychoanalytic psychotherapy. If you compare psychiatric treatment of chronic sicknesses or psychosis the relapse in psychiatric treatment is far higher compared to psychoanalytic healing. Question 14. Does psychoanalytic psychotherapy have variants? Yes, it is based upon the schools. Each school in psychoanalysis has its own way of conducting psychoanalytic psychotherapy. So there is a Freudian school, Jungian school, Kleinian school, Lacanian school, and so on. At least 10 major schools in psychoanalysis, and each of them have their own way of conducting psychoanalytic psychotherapy. So there is a variation. Psychoanalytic psychotherapy does come in all colors and flavors. Question 15. Which are the schools within psychoanalysis, and in what part of the world is any given school popular? Freudian school is popular in Asia, Europe, America. Jungian is more popular in certain countries in Europe and USA. Lacan is more popular in France and South America. Winnicott is more popular in UK. ISTDP in USA and now Australia. Kohut is primarily confined to USA. Even there now he is unfortunately getting forgotten. Question 16. Can the psychoanalytic schools be classified in conceptual terms under some broad categories? Yes, they can be. All schools of psychoanalysis can be classified into this way, into these groups. First group will be the group of drive school. The Freudian school or any school of psychoanalysis where psychological problem is conceived, conceptualized as a struggle between the drive and control of reality and morality, and the frustration that comes about. The frustration of the drive is the core there. These schools are called drive schools. Freudian school is one example of a drive school. Second group of schools in psychoanalysis are what is called as object relations schools. Kleinian school, Bionian school, they belong to object relations school. Third group is what is called the ego psychology group. Anna Freud's school, Hartman's school, they are all ego psychology schools. Fourth, you can talk about self-psychology school, which is Kohut. Fifth, you can also put as independent school of Winnicott. And sixth, you can put as Lacanian school now, which incorporates epistemology, philosophy, and linguistics. And seventh, you can put ISTDP and EDP. You can call that group the intense short-term group, which would have schools like EDT, ISTDP, and so on. So one way to divide all schools in psychoanalysis is to divide them into the 7 categories. 4 I have put in the book, 3 I have explained just now. So drive school, object relation school, ego psychology school, self-psychology school, independent school, Lacanian school, and short-term intense school. Question 17. Can every school of psychoanalysis heal every pathology with efficacy, or is there a school pathology connect? Every school has its own strengths and weaknesses. And the same symptom can occur because of a variety of reasons. Say somebody has a problem of paranoia of persecution. It may happen to the person because of a Freudian difficulty, or because of a Kleinian difficulty, or a quotient difficulty. The same pathology, the same symptom will occur because of multiple reasons. And based upon what is the reason, the school has to be selected. Unfortunately, very few therapists today have the conceptual capability and the honesty to tell a person about what they feel in terms of the causal root of the problem and what approach will suit the person. But yes, in truth speaking, every school cannot heal every pathology, because pathology may not occur because of what the school talks about. And on those areas, the school will have its limitations. Next 25 years, we will have to create this holistic healing grid, which tells us for a given personality, with a given pathology, of a given intensity, which is the best mode of treatment. Is it psychiatry? Is it cognitive therapy? Is it behavioral therapy? Is it psychoanalytic therapy? That is the work of next 25 years. As of now, it is by and large luck. Very few therapists have perspectives of multiple schools and the capability to use concepts and techniques of different schools. Question 18. Is it true that psychoanalytic psychotherapy takes us back to childhood to heal most of our psychological problems? Yes, it is true. And rightly so, because most of our deeply rooted problems, chronic problems, non-healable problems, they are rooted in our childhood, and that is where one has to go at the roots to solve the problem. And rightly there, psychoanalytic psychotherapy takes us. Question 19. Is it true that in the process of psychoanalytic psychotherapy, the patient often develops intense love or intense hate for the therapist? Yes, it is true. All feelings, not only love and hate, all feelings are felt intensely towards the therapist. All that is happening in life or has happened in life in the generic sense will play out with the therapist. Life will play out in therapy in a generic sense, not in the specific sense, in the generic sense. Life will play out in therapy in the generic sense. So yes, not only love and hate, but also envy, greed, anger, fear, everything will play out. All positive, all negative feelings, all templates will play out in therapy in a generic sense. That is where the opportunity is to recognize it, to identify it, to understand it, and to heal it. Unless something comes up in therapy, how do you heal it? So it is good that everything gets played out in a generic sense, because once it plays out, it becomes a part of the therapy process, and therefore it can be dealt with and healed. Question 20. Is there a way psychoanalytic psychotherapy can be made shorter and intense? Yes, traditionally psychoanalytic psychotherapy always has been a long-term therapy. Very deep, very profound, but long. Cost, time, energy, duration always have been limitations of psychoanalytic psychotherapy. Addressing these limitations, many experiments have been done. Recently, popular experiment is of ISTDP, intensive short-term dynamic psychotherapy, and EDT, experiential dynamic therapy. ECT also, emotion-centered therapy, some forms of it. Some experiments have also happened in the area of psychodrama. All these approaches take fundamental knowledge from psychoanalysis and then try to create short-term versions of therapy. And some groups are able to successfully undertake short-term approaches and benefit quickly. But there is no short-term and intensive approach based upon psychoanalysis which is universal, especially for patients who cannot endure challenge beyond the point and fragile patients who don't have capacity. Even the short-term models end up becoming long-term models. Our goal for the next 10 years is to make more universally palatable short-term therapy models, especially group therapy models. Question 21. Who comes for psychoanalysis and why? One group comes to psychoanalysis because they want to know themselves. That would be less than 1% of the total clientele. Second group comes because they want to access psychotherapy and they know about it. Either they wish to avoid psychiatry or they want to complement psychiatry. Second group. This constitutes in India about 70% of the clientele. Third group referred to the therapist by a psychiatrist or a homeopathic doctor. This group constitutes another 20%. Very few psychiatrists in India refer patients to therapy. Outside of India, it is very common. In the developed world, this is a large part of a therapist's practice. But in India, it is a minor part of a therapist's practice. So country to country, it differs. But all these three groups are there. Those who come to know themselves, those who come because they believe more in therapy than in psychiatry, or they wish to complement psychiatry with therapy but by themselves. And the third group, where a treating psychiatrist recommends additional therapy for patients. Question 22. What type of patients are best suited for psychoanalytic psychotherapy? Patients who are educated, motivated to undergo therapy, interested in the psychological area, interested in their inner world, about the subtle world of thoughts, feelings, values. Without doubt, it's an intellectual enterprise. There's no doubt about it. And it's not for everybody. You have to be of the type who is interested in the inner world primarily. If you're interested in the inner world and you are motivated to accept your problem and work through your problem in therapy, then you are suited for psychoanalytic psychotherapy. 23. How does psychoanalysis stand in the light of current neurological research? Neurology traditionally had not been able to investigate much about the concepts of psychoanalysis because of limitations in neurology itself. Fortunately, now horizons are expanding and more psychoanalytic concepts are getting within the range of neurology to explore. And the good news is that by and large, the research is supporting psychoanalysis. Even today, very esoteric concepts like projective identification, splitting, they are still far off. Condensation in the dream, how does it happen neurologically? This is still far off from a neurological standpoint. But in future, I have no doubt that neurology will research psychoanalytic concepts and it will not only prove them to be correct, but add to the efficacy of psychoanalysis. Question 24. Why does psychoanalytic psychotherapy take so long? It takes long because the problems are deep-seated. 2, we all can deal with difficult feelings only in small installments. 3, we all have an image to protect and there is resistance to acknowledging our problems. 4th, nobody wants to feel negative effects which are uncomfortable, unpleasant, like anger, fear, pain, guilt, shame, envy. And because we wish to avoid these feelings, we explore ourselves hesitatingly. There is a natural anxiety of these negative effects. And all of it put together, the therapy takes so long. It's also like you are trying to re-engineer yourself in a very fundamental way. And that takes a natural time. 25. Is it equally efficacious in all countries or does it depend on culture? In a generic sense, it is universal. Can it be applied in a vanilla format across? No, there is a cultural aspect to it also. So generically, it is universal and generically the concepts are true for all cultures, but the way it has to be applied in specific terms, that is different. In some countries where people find it very difficult to talk about innermost areas of sexuality, aggression, shame, it is difficult to practice this easily for a large section of population. There, easy to apply techniques like CBT, REBT, RET, logotherapy, they may work better. Not that the principles of psychoanalysis are not true, it is just that culture makes some therapies easy to practice and some therapies difficult to practice. That does not in any way reflect upon the truth of any therapy. Can psychoanalytic psychotherapy be taken along with medications? Of course, yes. And it is not only can be done, it is being done. If you classify all pathology into mild, moderate, and severe, when we talk about moderate and severe pathology, most of the psychiatrists, along with their medication, recommend the use of therapy. So the two go together very well. In fact, the combination of psychoanalytic psychotherapy and homeopathy also goes on very well. 27. Can psychoanalytic psychotherapy be taken along with any other psychotherapy? No. The patient at any given point of time should take only one form of therapy. If you are taking CBT, till CBT is complete, don't take any other form of therapy. Don't have CBT and psychoanalysis going on together. So go for any one form of therapy, and if you don't feel satisfied, let the therapy be over, give yourself a small break, and then go for any other form of therapy. What are the benefits of psychoanalytic psychotherapy? Healing of one's pathology to whatever degree one can, enhance self-awareness, a Socratic understanding of life, clear knowing of one's desire, behavior, and defenses from multiple perspectives, and a more wiser, informed way of shaping our own lives and making choices. There is no doubt that psychoanalytic psychotherapy enhances the quality of life in a radical measure. There is no doubt about it. 29. Does gender of the patient and the therapist make a difference in therapy? Initially it may, but in the long run, no. Because in the generic sense, everything gets played out anyway. In exceptions, however, if you are dealing with a culture where it's difficult to talk about most intimate parts of oneself with another gender, then in such cultures, the gender will make a difference. So there, people will prefer the same gender therapist. 30, is psychoanalytic psychotherapy costly? Yes. Compared to other therapies, it is costly. Per session cost is also high, and number of sessions required per week also is high. And number of weeks required are also high. So usually it is 2 years and 2 to 3 days a week. So, and the cost of per session is also very high. So it is costlier, and that is what restricts the use of psychoanalytic psychotherapy by the masses, by a large part of society. Psychoanalytic psychotherapy as it is essentially accessed by the elite, the top 10% of the society. Why is it so costly and not easily available across the world? Good psychoanalytic psychotherapists are few. This is not a profession where you can work 12 hours a day. You cannot do more than 3 to 4 sessions a day if you have to do justice to it and justice to yourself and prepare for the sessions. So that is one element which leads to cost, that you have few people who are good and they can work only for a few hours and everyone wants to go to them. So there is a natural demand supply skew. Second, it takes a long time to become a good psychoanalytic psychotherapist and a very high investment financially in the training process. That creates a second element of cost. Third, because it goes into the depth of it to the roots, number of sessions required is very high. That's a third element of it. That's how it is costly across the world. One way out would be group therapy, but we have not done enough to develop group therapy, and many people find it difficult in groups to talk about their most intimate things because of the confidentiality issues and shame issues. So we have not really found a solution to this, but we are trying. I have tried myself a few models to address this problem. 32. What is the generic sequence of flow of events in psychoanalytic psychotherapy? Exceptions apart, the generic flow is like this. First, a patient knows about psychoanalytic psychotherapy, or he has at least heard about it, or psychiatrist has told him about it, or a friend has told him about it, or he has gone online, or he has read a book, and he wants to explore if psychoanalytic psychotherapy can help him. Step 1. Step 2, he seeks an appointment with a psychoanalytic psychotherapist. Step 3, patient talks to him. Step 2, the patient goes to meet him, talks to him. Both of them, if they agree, the patient decides to go for psychoanalytic psychotherapy. Then the patient decides on which therapist to go for. Then the therapist and the client work out a contract and the frame, the do's and don'ts of therapy. Then the first meeting happens, and in the first meeting, the case history is taken. This is usually a long session. If a normal session is of 50 minutes, 45 minutes, 50 minutes, or some people even can go to 1 hour, case history session requires 2 hours. And after the case history, the psychoanalytic psychotherapy begins in normal way. So you come for 3 days a week, 45-minute session, 15-minute or 1 hour session. Most common is 50-minute session. And then as the healing happens, it goes on happening, the process goes on. And when the healing is felt to be adequate by both of them, therapy is terminated. This is the generic sequence of events in psychoanalytic psychotherapy. 33. What is technique in psychoanalysis? Psychoanalysis can be divided into conceptual part, technique part, and the testing part. Technique part refers to how to do therapy. When you try to understand how to do therapy, the elements in that domain are first, setting of the frame, which includes how many sessions per week, fees, venue, timing, payment system, etc. It also includes whether it will be face-to-face or on the couch, or maybe starting off face-to-face and then going to the couch. Technique also refers to whether you are following strict psychoanalytic or psychodynamic technique. It also involves cohesion supportive stance or a classical interpretative stance. Technique also involves dealing with issues like transference, counter-transference, projective identification, holding. We'll deal with these concepts later. All of this forms the part of technique. All the do's and don'ts also come in technique, in the frame. What is 34? What is frame in psychoanalysis? Frame is a structure of therapy. So the therapy happens within a structure, which is decided by consensus between the patient and the therapist. So the structure of therapy involves the number of sessions per week, day and timing, the place, the way interaction will happen between the therapist and the patient, the do's and don'ts. Therapy is based upon the principle reflecting, not acting. It has to be strictly followed. Physical acting out is not a part of what is allowed. There is talking, there is no living out of a relationship with the therapist. And outside of therapy, there is no contact. And the therapist will not take any benefit from the patient, either in cash or in kind, except the fees. This framework of therapy is what is referred to as the frame, the psychoanalytic frame. It is a structure of law, of a legal contract, of guidelines of therapy, the do's and don'ts of therapy, which constitutes the frame of psychoanalysis. 35. What is case history? Case history, before we start therapy, we take the case history. It includes all the details of the patient's lives from birth till the day he has come for giving case history. It includes economic information, educational information, medical information, psychological information, family history, family tree, development of pathology over time, what has worked, what has not worked in healing the pathology, and so on. The entire collection of information is called case history, and it's taken in a particular format. It is a standard case history taking format. 36. What is free association? The patient comes for therapy, lies down on the couch and speaks whatever comes to his mind without any self-censorship. He speaks spontaneously, expresses whatever comes to his mind. This expression is called free association. What is an interpretation? Just as the patient is making a free association, the therapist tries to find out from that, using his knowledge of psychoanalysis, what does it mean in terms of something in the unconscious. That expression of knowledge, of insight, for the purpose of healing, for the purpose of making the unconscious conscious, for the making of making for the proper purpose of facilitating catharsis, that intervention done by the therapist verbally is called interpretation. 38. What is a process note? After every session, the therapist is supposed to write down verbatim exactly what he said and what the patient said during the session and how he felt at each of the stages. And then he can reflect upon what is going on in unconscious terms between the two of them. He can also see how it is working out over a series of sessions and what is useful and what is not useful. The noting down of what he said and what the patient said verbatim is called a process note, and the process note is used for self-reflection, as well as the process note can also be taken to a supervisor for supervision, of course with the permission of the patient and keeping the patient confidential. The patient does not know the supervisor does not know the patient. 39. What is supervision? Because no therapist is perfect and psychoanalysis by its nature is such that emotionally you are involved in the process, it's difficult to be neutral and objective about oneself. So occasionally one takes a process note to a senior person who is a supervisor to get a neutral third party and a wise man's, more experienced man's opinion on what is happening right, what is happening wrong, and how best we can serve the purpose of healing for the patient. Can psychoanalytic sessions be recorded, audio or video? No, they cannot be recorded because the contract of confidentiality just does not allow it. And psychoanalytically speaking, the moment a recording device is placed, audio or video, society enters into the therapy room and the safety is violated. And there is third in the room, when in fact there should be only two. So it cannot be recorded. Exceptionally, in some cases like ISTDP, which is based upon psychoanalysis, but which goes into video recording of every session, it is done. But it's done with clear, explicit written consent of the individual. Never without written consent. 41. How does psychoanalysis work? One of the most difficult questions, but partial answer we can give. We can rephrase the question to say, how does healing happen in psychoanalysis? What heals? First, ability to speak out what we cannot speak out in front of others. That lightens our chest and we feel emptied out, light and better. So self-expression heals. Revisiting the past heals every time we revisit. Closure happens in every revisit and that heals. Closure heals. Objective analysis of what is half analyzed inside of us, that heals. Catharsis heals. Internalization of a good object heals. Holding provided by the therapist heals. Despite our expressing what would be attacked in the normal society, when that is not attacked, that also heals. Internalization of a good, reliable, stable object also heals. Cognitive insights and knowledge also heals. All this leads to healing, and all of it is at work in psychoanalysis. That is how psychoanalysis heals. 42. Can a therapist enter into relationship with the client? No. Till the therapy is going on, the therapist cannot have any relationship with the client. After the therapy is over, in India, after 6 months, you can have a relationship. In most developed countries, the moratorium is of 2 years. After the therapy is over, after 2 years, you can have a relationship, but not before that. And this is to take care of the strong transferential, counter-transferential dynamic which goes on in therapy. 43, what is cancellation policy? If a client does not come for a scheduled session, then the client has to pay the therapist even if he has not come. If the client does not want to pay for sessions he has not come for, he has to abide by what is called a cancellation policy. So cancellation policy means the policy which tells you how early you have to inform the therapist about a cancellation so that you don't have to pay. If a therapist has a cancellation policy of 48 hours, which means 48 hours before the scheduled session, you have to inform him if you are not going to come, then you don't have to pay. But if the cancellation policy is 48 hours and you inform the therapist 24 hours in advance, you still have to pay because the cancellation policy is 48 hours. This is a part of the contract. Before you begin the therapy, you sign a contract and the cancellation policy is a part of the contract. The strictest cancellation policy I have seen is the therapist would take 2 monthly breaks in summer and in winter, 1 month in summer, 1 month in winter, and the client would have to use this very months to go on a vacation himself. Otherwise, regardless of what the client does, he has to pay. Strictest topic. And the most liberal I have seen is the client just does not pay for sessions he does not come for. Even if he does not inform, it just does not come, he does not have to pay. The most liberal. Standard is usually 1 week in advance cancellation policy, the most common. 44, what is termination? Once the goals of the therapy are achieved, the goal may be complete cure, partial cure, or good enough cure. Once the goals are achieved and both of the client and the therapist have a consensus, the therapy is terminated. And usually termination is a well planned out process. Last couple of sessions, say 4 sessions or 5 sessions or 1 month of session is used to slowly taper off the therapy in the termination phase. 45. Can a therapist suggest that the therapy with him be terminated and the patient should seek help with some other therapist? Yes, it can be done. If the therapist is honest enough that he is not able to help the client or whatever he could do has been done, then he may talk to the client that there is nothing more he can add to the client and the client will be better benefited by being with some other therapist. And in such cases, therapy with one therapist can be terminated and it can be started with another therapist. In some cases, it can be that therapist is practicing one school and he feels that the client will be benefited by another school. Or the therapist has been used to see one particular type of clients and he is of a very different type. In such situations, it's better to talk to the client and hand over to somebody who can do more justice to the client. 46. How does research happen in psychoanalysis? Very difficult because everything is confidential. But some patients do allow use of all that happened in the therapy for research purposes without revealing the identity. That is how research papers are written, discussed, books are written. Patient identity is always confidential, but the material can be used with permission of the patient. 47. Is hypnosis used in psychoanalytic psychotherapy? No. In early days, Sigmund Freud used to use hypnosis in psychoanalytic psychotherapy, but soon he found 2 limitations. One, everyone could not be hypnotized, and 2, often the attainments in hypnosis were not permanent. Because of these two limitations, Freud stopped using hypnosis very soon, and today nobody uses hypnosis for psychoanalytic psychotherapy. Hypnosis is used for hypnotherapy. It's a different form of therapy altogether, but not in psychoanalytic psychotherapy. We don't use hypnosis. 48. Is there any code of conduct for psychoanalytic psychotherapies? Yes, there is a code of conduct laid down by IPS, International Psychoanalytic Society. In some countries, the law of the country lays down the code. 49. Who is fit to be a therapist? One who is interested in the inner world, one who is interested in helping people, one who is not financially driven, exclusively speaking, and one who is open to going deep into one's own school and other schools and be able to see every patient as unique, even as one sees the commonality across patients, and one who is very good in language and creativity. Lastly, one should have a very good holding capacity. With these qualifications, one becomes fit to be a psychotherapist. 50. Is a master's degree in psychology or clinical psychology enough to practice as a psychoanalyst? No. Master's degree in clinical psychology may be a legal necessity in a country, but from capability standpoint, one has to undergo a long program in psychoanalysis, which involves at least 3 years of coursework, 500 hours of one's own therapy called training analysis, and seeing cases under supervision for a long time. These three take usually 3 to 5 years, and that is the time necessary to undergo a long training to become a good psychoanalytic psychotherapist. A classical university master's degree is not enough. How can I become a psychoanalyst? Copybook solution is to enroll in any center affiliated and recognized by International Psychoanalytic Society. Or in some countries, you may have national level psychoanalytic societies which are recognized by law. Or there might be some universities recognized by law of any given country where they teach psychoanalysis and give degrees, and the degrees are perfectly legal and ethical. Or you may go to some centers which are like NGOs who may not give a legal degree but can give you the knowledge, and you can get the legal degree from a university. So these are the ways one can become a psychoanalyst. 52. Why does it take so long to become a psychoanalyst? One is a regulatory aspect of it. In many countries, you have to first do a master's degree in social work, psychology, or psychiatry, and then you go for psychoanalysis. So that makes it long. Second, the process of psychoanalytic training itself is very long. Third, you have to write papers or thesis based upon real work, and that also makes this process very long. Fourth, this subject is not easy, so that itself makes it time consuming. And there's so much happening in the subject, so much that has already happened in the subject. All this put together makes it a very long process. Officially, it is 3 years, but actually it takes around 4 to 5 years. 53. In India, where are the various schools of psychoanalysis anchored? Freudian school is anchored at Kolkata and Ahmedabad. Freudian school partly is in Delhi also. Winnicottian is in Delhi. Kleinian at Mumbai. Jungian at Bangalore. Jungian now also has an anchor in Ahmedabad. 54. Can violent patients be treated with psychoanalytic psychotherapy? They have to be calm enough for therapy in the session. If they become violent in the session, you can't treat them. But if they are violent, they have been given psychiatric drugs because of which they are under control. Then till they are under control and if they are motivated for therapy, they can be treated. '55. Is psychoanalytic psychotherapy done the same way across groups? How do you do it for children? We can divide it into two parts, adults and children. In fact, three: children, teenagers, and adults. And the way you do therapy for three is different. Children cannot be so articulate in language, so play therapy is used. They are given games to play or they are given the playroom and they are observed. You can talk to them, interpret them. You can see them torturing the toys. You can interpret to say that do they wish to torture their parents or caregivers or siblings of in this way? So the interpretations are done based upon activity. Catharsis is done based upon activity. It's an activity-based psychoanalysis. So the principle reflecting, not acting, goes out of the window with children. They act out and the therapist reflects. 56. Does psychoanalysis believe in God? Traditionally, most schools of psychoanalysis and most psychoanalysts themselves, founders of schools included, have been materialists and atheists. So traditionally, psychoanalysis does not believe in God, treats the concept of God as a fantasy concept of an omnipotent father figure or omnipotent mother figure. Exceptions are Jung was an exception. He was open to the idea of soul and God. Kohut, almost on the borderline, not going far enough. But traditionally, psychoanalysis has been anchored on the philosophical foundation of materialism, individualism, hedonism, and atheism. '57. Is psychoanalytic psychotherapy dependent on religious beliefs? No. Religious beliefs don't affect psychoanalysis so much till they don't come in the way of the practice of therapy. For example, if in the course of therapy, homosexuality is found, discussed, and then the person says, in my religion, this is not allowed. So even though it is there, I won't talk about it. Then in such cases, the religious feelings may come in the way of therapy process, but usually it does not happen. 58. In which academic areas today psychoanalysis is being used apart from the purpose of therapy? So as we said, psychoanalysis has two broad uses, clinical use and non-clinical use. And non-clinical use, the intellectual use, is in understanding any science of humanities or social sciences. So psychoanalysis is used in economics, marketing, film studies, history, arts and literature. Practically every area of humanities and social sciences you can use psychoanalysis. 59. On what grounds is psychoanalysis criticized? Many standard criticisms of psychoanalysis are prevalent, floating around. First is it may not be scientific enough because data is confidential, empirical investigation cannot be done. Second is a feminist critique that it's a man's science. It has understood the mind from a man's point of view. Third is a conservative criticism that there is too much of individualism, hedonism, materialism. Fourth is the criticism for pragmatists. They say psychoanalysis dramatizes everything, exaggerates everything. Fifth criticism comes from other schools of therapy, which say that the emphasis on the unconscious is misplaced. One should focus upon the conscious mind and the willpower. Sixth is within psychoanalysis, one school criticizes another. So there may be schools which say that Freud puts too much of emphasis on Oedipus, or Freudian school may say Kleinians put too much of emphasis on the split. Karl Popper used to be a severe critic of psychoanalysis, calling it a pseudoscience because it does not pass the test of falsifiability. But then there are number of hard sciences, so-called hard sciences, which do not pass the test of falsifiability. 16. Does psychoanalysis have a future? Yes, it has a glorious past, a good present, and a very good future. I would say a glorious future. It's a very powerful theory of the internal world, and I'm sure as innovations happen in psychoanalysis of making it quicker, more empirical, and shorter, and easy to go through, and as neurological studies explain it, support it, I'm sure psychoanalysis will have a brilliant future. My feeling is it will get combined with psychedelics, homeopathy, and certain forms of group therapy, where we'll have a very powerful combination of depth, intensity, short term, and the group reality. Psychoanalysis can also be in future, I think it will go along very well with homeopathy. So it has a glorious future, no doubt about it. Freud used to say, psychoanalysis is in essence a cure through love. So with this, we finish the first chapter. In the next lecture, we'll take up chapter 2 of FAQ psychoanalysis, Sigmund Freud. Thank you.